Diem, take us through this journey. Now, how is this finding out again that you have cancer different than the first time?
Well, basically, it was a complete shock. Like, I didn't understand really that it could come back again. Like, I was told the ovary was gone, and then I just didn't think it would ever come back again. And so finding out that you have it a second time, it's like, I've already done this. I thought I was over it. And so now it's kind of just being able to kind of just push forward. And now it's the fact that I only have one ovary left, and they're going to remove the rest of it. So now I have to make sure about freezing eggs and learning about menopause. So all these things that I wasn't thinking about the first time.
So tell me about this. You have delayed your treatment since your diagnosis to do some fertility management. Tell me about that, because that seems, I first heard that, I thought, oh my God, I got to talk to this girl. That sounds dangerous.
I mean, I got ovarian cancer the first time at a really, really young age. And so, you know, that's kind of weird and kind of something that you're not normally doing. So having a baby is normal. It sounds, you know, funny to say that, but having a baby is normal, and I wanted something normal. And yeah, being a mom is really important to me, and I want to be able to have my kid. And so if I can use the technologies that are out there and try to freeze eggs, because 6 years ago, you couldn't freeze eggs. You only could freeze embryos. So now I have the opportunity to try to freeze an egg. And I want to try. I really, really want to try.
How is that going? Are you getting ovarian stimulation right now?
Yeah, I'm on the awesome shots.
Oh, yeah, aren't they nice?
It's funny because you watch. Oh yeah, they're super fun. My mood swings are awesome. But it's funny. You see things on TV like, you know, Bill and Juliana, and you see, you know, the IVF and all these things are being brought to the forefront. And because of watching these shows, I knew about it, and that became normal to me. Like, I hear about more people freezing eggs, more people having problems with fertility. So you're hearing about it more. It's not so embarrassing. So that's why I've really been public about this and like trying to freeze eggs, because to be honest, my doctor told me I'm, if not the first, I'm one of the first current ovarian cancer patients to ever get hormone shots to freeze eggs.
Yeah, I bet you had trouble finding.
Someone has to be the first.
Yeah, I bet you had trouble finding somebody even to do it. And what we're talking about here is what needs to happen is this ovary is stimulated to produce follicles, which are eggs that eventually get fertilized, and the eggs get harvested and then frozen and then used at a later date after the cancer treatment is completed. But how long did you have to delay your cancer treatment to do all this?
I'm delaying it about a month. And yeah, I know that sounds really dumb to most people. But the thing is, once that ovary's gone, nothing. I don't have anything to try. So if I could try to push it, like basically, you know, I've already had a surgery and they have to go back in and they have to remove the other part of the ovary, the last part of my last ovary. So if I can try one time to kind of do this cycle, I really want to, because in a weird way, if you think of all the things I have to do, I'm going to have to go through menopause, going to have surgery to get that last ovary out, then have to have chemo. Those are not fun to think about. So if I can try one little, sounds weird, but some of my fun thing about gathering eggs out first, I kind of want to try that. And
I think, again, for purposes of people understanding at home, we really don't know the full impact of ovarian stimulation on existing ovarian cancer, depending on the cell type she has, and then you're delaying your treatment, and that's risky. But I understand you're clinging to that piece of health, that piece of normalcy. I get that. Let's take a call, Diem. Angie in Wisconsin. Angie, you want to ask something?
Yes. Hi, Dr. Drew.
Hi, Angie.
Diem. I have a two-part question for you, Diem. First, I was wondering what symptoms you were having that caused you to go back to the doctor. And second, I read that for a while you didn't know if your symptoms were real or if it was just you being a hypochondriac. And as someone who worries about my health all the time, I'm curious how you knew that the symptoms were you know, that you needed to worry about.
It's a great question.
Well, it's a fantastic question. And to be honest, I actually started having pains back in October. And it was the same. The ovarian cancer is so hard. It's called the silent killer because there's really not many testing to find out if you have it until it's kind of too late. So I had like bloating after I ate. I would go in the bath to make sure like the only thing that would make it feel better is like a hot bath. So I started in October, but I got my CA-125 test, and that's like a tumor marker. And I got that in October, and it was fine. And when you've been sick, you're like, oh, I had that done. I'm fine now. I'm fine. But I knew I wasn't. And then January rolled around, February rolled around, and I knew I had to go back to my GYN in May. So I'm like, I'll just wait till then and get a checkup. Ironically enough, I got my pap smear in May, and it was fine.
Well, the pap smear doesn't detect. A week later. Go ahead.
Oh, a week later, I went back, and I'm like, something's still wrong. And so I got an internal ultrasound, which I really wish more women got on their yearly checkup, because internal ultrasounds, they see everything in there. And they saw an 8-inch cyst from hip bone to hip bone.
Right. And Diem, again, pap smears don't usually detect ovarian cancer. The doctor can feel the ovaries and sometimes detect something and then trigger the ultrasound. But, yeah, you're right. Ultrasonography would be very, very helpful.